Okay, so and we are live. Hi everyone, welcome. So today life has been a sprint, just sprint or a marathon, like back to back. Because all of my guests they just happen to be free today, and you know it was very short notice. Everybody has been so kind, like I think you guys are the reason why my delivery just kept on increasing. Like I can't do it because you guys were like so kind. Okay, I'll be there, sure. Like thank you guys so much. By the way, guys, we have Dr. Joy. Dr. Joy is joining us now for this session, and we're going to be talking about all things medical, all things psychological, and we'll just be hearing her takes really on this matter. So before we go ahead, Dr. Joy, please can you call out your Instagram handle?
Sorry, I didn't hear that. Can I?
Can you call your Instagram handle?
Oh, fixed in bloom. Fixed underscore in underscore bloom. I'm actually almost not active on Instagram, but yeah, that's my username.
What platform are you active on?
LinkedIn.
I
LinkedIn.
okay, you can find your LinkedIn. So we'll do LinkedIn for this section. I'm also very more active on LinkedIn than I am on Instagram. I don't
Yeah.
know how people do Instagram. I don't know.
Watch stuff like I'm never posting anything. I just like watch stuff and leave. Yeah.
Okay, so I'm going to send you a message right now. So you can just drop your LinkedIn profile in
Right.
the in-call message, and yeah, we'll get started.
Okay. Um. It's
Guys, give us a minute. Let's let's fix this. Okay.
hello. Yeah, I'm still with you.
Yes, I can hear you clearly.
Okay, great.
Okay.
I was trying to type in my LinkedIn, but it's just really my name. Just DJ.
Oh, I'm not Yoruba, so that name is always like
Yeah, yeah,
I'm trying to bite my tongue. But yeah, Joy Adig
I
said,
did
did I get that right?
yes, yes, yeah, do it.
Okay. Okay. All right, guys. Yes. So it's up. Okay. Yeah. All right. So we'll get into it in proper. Thank you again, Dr. Joy. Thank you so much for joining us. Before we even get into questions, do you mind introducing yourself? Tell us what you do.
You. Yeah, hello everybody. My name is Joy Ashepolu Adegbite. Medical doctor, direct community medicine slash resident doctor in community medicine. My job is essentially preventive medicine and providing primary health care in community. So I'm usually working in a primary health care center, and you'll find me in any preventive medicine, any public program, like family health education and promotion, that kind of stuff.
Okay. So I don't think I don't know if it's
Hmm. I lost you. I can't hear you now.
now I can't hear you again at all. Can you hear
Okay.
me?
Yes, I can hear you. I
Can you
can hear
give
you
like
now.
a thumbs up if you can hear me clearly?
Yes, I can hear you now. I lost you for a bit, but I can hear you now.
Okay. Then it's definitely my network.
Okay. Yeah, I can hear you now. Hmm. I can't hear you anymore. Hello. Hello. Can't hear you anymore. It's frozen. Okay. I still can't hear you. Okay. I'm fixing it. Okay.
You can hear me now, right?
Yes, I can hear you now. Yes.
Oh, see, I like you guys already know the drill. The network issues that I'm battling with, God will save me and help me, really. And I think it's general because every other person is just complaining. Uh, and it's even more frustrating because I work remotely. But
Oh, sorry.
we move. Okay, so thank you, Dr. Joy. Thank you again for joining. So we'll get right straight into get into it because I know you're still in the hospital and emergency can come.
I have lost you again. There's no sound. Uh, oh, good. There's no sound. I can't hear you. Sorry. Hello. I still, yeah. I know you're talking, but I can't hear you. Are you sure you're not muted?
Can you hear me now?
Yes, I can. Okay, great. I can hear you now.
I promise you I was not muted. I just
Oh,
cannot use my laptop for sound, right?
oh,
It has anytime I go on like calls, the sound just becomes really muffled. So I have to use like another gadget as a mic and
oh my God. The sound is off again.
you still cannot hear me.
Okay, now you're back. So you went off and then now you're back.
Oh. Hey, hey, Dr. Joy, there's fire on the mountain.
How we go? I can see your mouth moving. It just goes off. I can't get anymore. But yeah, let's keep trying.
Okay, how about now?
I can hear you now. I can hear you now.
Okay, you can hear me now. Now it's better.
Yes.
Oh my goodness, guys, please pardon me if you're watching. The network issues is
Also,
a big,
yeah, just really.
it's a big, it's just so frustrating. But yes, my question was, I was asking that for someone that has gone through abuse, right, that has experienced abuse, what is the very first thing they need to do medically?
What's the what's the for someone who has gone through abuse, what's the I didn't hear that.
I don't think I can hear you any longer.
Okay.
I don't
The,
think I can hear you.
the question again. Uh,
I don't think I can hear you. I don't know if you can hear me. Sorry, can you hear me now? Is it better? Is it better? So I'm not sure if this is my network or her network right now. Let me try to message her. Oh no, I don't think. Hi, Dr. Joy, please can you hear me? I think it's her network that has gone off. Trying to message her to know if it's my network or if it's her network. Let's see. Can you hear me?
Okay. Okay. Still hear you. Can you hear me now? If you can hear me, can we like use another platform and then we'll record and upload on YouTube or something? Hello?
Can you hear me now? Can you hear me now?
Okay, yes, I can.
Uh,
Okay, I can now.
yeah, it was.
I can hear you now.
I'm sorry, though. I'm really sorry. I'm so sorry.
Okay.
So I
If
was
this doesn't
asking
work,
my question.
okay, okay. Let's hope
Sorry,
it
what did
works.
you say?
I was going to say if this platform doesn't work, can we like do another platform, record and then put on YouTube? But let's hope it works. Let's hope it works from now. Yeah.
Let's just hope it works from now, really. And
Okay.
if I can just even cut this part of YouTube before adding, but I mean, can I even do that? I think I can cut it, download and upload. But anyways, guys, just in case you see it like this, we apologize. We apologize for everything, really. Um, okay, so my question was, for someone who has experienced abuse, what would you say is the first thing we need to do medically?
Okay. I lost you, but for someone who has experienced abuse, what's the first thing that you should do?
Yes.
So because I'm a doctor, I'm going to speak from physical abuse and sexual abuse because that's typically and sexual abuse really because those are the areas where we actually come in. For sexual abuse, let me start from there. I would need the person to say a rape or sexual assault. I need the person to get to the hospital as soon as possible. Say the sexual abuse is rape. We usually encourage that victims would come to the hospital not later than 72 hours. So within 72 hours, within 3 days, preferably immediately it happens, they get to the it's usually very hard, and when it happens, people are even so confused, so shocked that they might not be able to call out for help immediately. But medically, most of what we can do is most effective when the patient presents within 3 days. So, in the case of rape, we want to administer emergency contraceptive because, I mean, if one is raped, we don't hope that, or we don't expect that the person would get pregnant, get pregnant from the rapist. So we want to give emergency contraceptive, and that's most effective within 72 hours. Most effective within 24 hours, but not later than 72 hours. So there's emergency contraceptive to use. There's also some people are gang raped, so there's um prophylactic post-exposure prophylactic drugs for HIV and other STIs, particularly HIV. So for instance, if you suspect that the rapist is HIV positive, might be HIV positive, we want to give the victim. It's called post-exposure prophylaxis, but it just means drugs to make sure that the person doesn't get HIV, even if the perpetrator is HIV positive. So those are like the most important things that we want to do, and then psychological support as well. I think a psychological support is more effective when it's immediate, when the support comes immediately, as opposed to when the event has been for a while and the person suffered psychological impact over a long time. So early presentation is what I would say is very important. It's hard, and our community doesn't really encourage people opening up, you know. But medical is just best to come as soon as possible. Physical abuse as well. Physical abuse as well. People, get beaten, and they think they just have physical injuries, but then sometimes the injuries are internal. You know,
Yeah.
some very serious beating. Yeah, so it's just helpful to come early, to try as much as possible despite the pain, to come to the hospital as soon as possible.
Mm. Okay. So, what does because you mentioned trust as you were speaking, you kept on mentioning come to the hospital as soon as possible. But there are some scenarios where even your um, abuser, right, is not even allowing you go to the hospital, or you can't even leave the house if it's your partner, or you are just like really physically not able to go to the hospital. What does emergency care after abuse? What does it actually involve? Like in real life that you can easily use? What can you take at home? Uh, I don't know. Like, what would you say would be like emergency? I can't go to the hospital right now. I would go, or what do I need to do, like immediately?
Right. Immediately, say for sexual abuse, I think you still have to, a victim will still have to leave the house. What I've found is, okay, so one, if it's physical abuse, you want to call for help. Even if you cannot go to the hospital, let somebody know that this has happened. Maybe they can come to the house to help. I don't know if there's any functional emergency line in Nigeria. That would have been the best thing to do. What I found is, some women come to the hospital. So there was this, sorry, just a moment.
Okay.
Sorry, that was the solar making noise. Okay. Yeah, so I was saying, sometimes I find that what some victims do is, they come to your stool under the pretext of something else. So I've seen a patient come in. She even came with her husband. Apparently, she had been a victim of intimate partner violence, and she came, complaining about something else. And he actually really took a discernment, or asking further questions to realize she had been a victim of intimate partner violence. She just came giving symptoms like, oh, it's malaria, oh, blah 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 blah. And then I just asked the husband to excuse us. And the husband was so, pretending to be lovey-dovey. He came in with her into the consulting room. That's what I just figured. And then I just told him to excuse us, and then we were able to get to the root of the matter. And then because of how our culture, our society is framed, we have to really do everything very discreetly. I had to write my number on a paper. We just have to be really discreet, because if you take it up, she's going back to that same man. And she's already saying
Exactly.
if you knew that that was what she told me, of course she's probably going back home to another round of beating. Yeah, so I find that women come under the pretext of something else. I'm going to just do because I feel like I'm feverish. They don't say that they are going because of that. So I think that
Yeah.
works as well. At least in practice, people would come in under the pretext of something else. Then some of them don't even go straight to the point to say, "Oh, this is what happened." It's really just I expect that a good doctor after a while you just ask more questions and realize this is likely what is happening.
So I really don't know why our culture is like this. Like, why do we shame the victim and not the abuser? Sometimes you hear things like, "Oh, my husband beat me." They will ask questions like, "What did you do?" Like, what is wrong with us?
Yeah,
Or you were raped and someone is asking you, "What did you wear?" Like, excuse me, there are pedophiles that are sleeping with children. What did the children wear?
it's totally crazy. I think it's a problem. It's a problem with our socialization. Um, if you think that it's not even just the perpetrators that think that way. Some women come in and they're like, "Oh, he beat me, but um, me to have my, I made him angry." Blah blah blah. And yeah, it's like I said, it's a problem with socialization. I was going to say it's a problem with patriarchy, because if you think that you are,
I think so. I think you are definitely correct. It's a problem.
if you think if you think that you're superior, if you think that you're better, then it makes sense to also think that you can do and undo, or you can, subdue by by violence. So sometimes we want to help, and women are saying no. It's okay for him to do that. I am the one that made him angry, and it's just really hard to help them because you're like, oh well. If you don't think that something is wrong, then it's very hard to help you. And then the cultural and societal expectations that women should remain in marriage. You tell some women, why don't you leave? And they're like, oh, my children. Sometimes it's economic factors. I just saw a woman
Yeah.
about a week ago. And so now when I see a woman and her symptoms are not adding up to anywhere, I ask about her marriage. That's like a principle for me now. Like when a woman comes in with this, the symptoms are not adding, like she's just complaining, her complaints are not adding up. I typically would ask about her marriage. So this woman asked her about her husband, and then she was like, "Oh, that he used to beat her, but not anymore because now he's lost his job and she's the breadwinner." So he's like, maybe respect, at least for now, he's respecting the fact that she's the breadwinner. And then once that one time she had to get a restraining order from the police station, so that now he's not troubling her again, but that then he used to beat her and all of that. And I'm like, why did you stay? She's like, oh, because of the children. So we find that as well. Sometimes you want to even intervene, but patients are like, oh no, I'd rather keep my marriage. I don't want anyone to say I'm washing my dirty linens in public, all of that.
I think we need to normalize that you are not the problem, right? The people, right? The abusers should be the ones who are supposed to hide their face, and not you, the victim. I don't even know what is wrong with like our society, right? And most times it's because we've looked at it as a normal thing now, a normal thing. So even you are there, you are dying in the marriage, and somebody is telling you that, oh, ah, you want to divorce, as if you want to leave your marriage, as if it's something that should not be heard of. Don't get me wrong, we are not preachers of saying divorce, but if your life is in danger, this person is abusing you. Guess what? I think I said it in the first one. Marriage ends on earth. There is no marriage in heaven, just in case you are wondering.
So yeah, right. So I think when you're
So
like the inside marriage. So yeah, it's when you're like the inside.
exactly, your identity is not to be a married woman. That is not your identity. Please. Uh, I think we need to please go
Yeah,
ahead.
yeah. So I was going to say, I found that you know, the first thing that was it was quite straightforward. Somebody abuses you, just take your bags and But it's really more complex than that, right? There are lots of determinants. So there are social determinants, there are psychological determinants. There's the part that some women economically cannot, stay on their own. They are dependent on the men. There's the social expectation of women, the religious expectation of women. They are told to submit, to endure. Love is long suffering and all of that. Then there's also the psychological attachment. Apparently, it's hard, you know, to live. I think it's even worse for intimate partner violence, because it's somebody that they've had good times with, they made good memories with, someone that they also thought that they loved. I think it makes it more complex to live. Those emotional attachments make it more complex to live. Add that to the other things with the society, with culture, and also because abusers are not always, they're not totally bad, and there's manipulation, there's dropping bits of niceness, and then the person is just really confused. What are you now? You're an angel today.
Yeah.
And what I was also saying about the entrenched beliefs in women as well. Um, we also have a culture that that permits abuse, or at least permits physical discipline in quotes. So you feel like, oh, my father was an authority figure and he could beat me to correct me. Now, if my husband is also an authority figure and I do something wrong, then
Mm.
physical violence might also be a means of correction. And when people get that idea, it's just really hard, you know, to help or to change things. So I think it's a complex cycle, really. It's a
Yeah.
complex
It
cycle.
is. It is. And that's the reason why you remember I told you that I wanted. Can you hear me?
Yes, I can hear you.
Okay. So you remember I told
Okay, now I cannot hear you. Now I cannot hear you. Can't hear you anymore. I can't hear you now. Sorry, I can't hear you anymore. Hmm.
you still cannot hear me.
Okay, now I can hear you now. I can hear you.
I could hear you clearly though.
For me, I'm just seeing your mouth moving. But I can hear you now.
Okay, so I said, you remember I was telling you that I wanted to bring in a therapist so we can just talk about the mind, the
Mm-hmm.
body in general. But she was too busy to join. And I really like the angle that you are coming in from, because you hear some certain things and you're wondering, like, for crying out loud, why would you even think so? Like, I've heard, like, oh, my husband has to beat me. And this person was in the verge of, actually, I don't want to go to the extreme to say she was almost dying, but she had been beaten so bad that you, to even stand and look at her, I was having goosebumps. But to hear her say things like, "Oh, he has to beat me," that shows that he loves me, and I'm like, "For
Right.
crying out loud, what has gone wrong with your mind for you to think that someone who loves you has to punish you that bad?" And it's so crazy because this thing needs to stop. It needs to end. It's not even a matter of, oh, we are just talking about it or what's it called, but it is
Yeah.
an important thing because people lose their life literally.
Right. Right. And that's why support has to be sustained. That's why support has to be consistent, has to be sustained. People think that, oh, you talk
Mm.
somebody go say, oh, get up and leave, and that solves the problem. Because it has taken a while to build those mindsets. Also because, like I said, the factors are complex. Whatever we're doing as an intervention should be sustained.
Mm.
Sometimes there are even support groups for these women, but they are here today and not there tomorrow, and that's not really how it works. Or some people show concern for a while, and then sometimes when the women are then willing to leave, they can't get that support anymore.
Another scenario that I see common is sometimes, surprisingly, fellow women, right,
Of course.
are the ones who do, ah,
Yeah.
like,
Yeah.
like, okay, it's the fact that you feel like a marriage, like marriage is your identity, is always what always surprised me. That you would see a fellow woman suffering and you say, oh, hush, don't talk, keep quiet. And you hear advice like, now so we said deal, now so we said they,
Yeah.
and like,
Endure. Oh God, that's how all men are. All those things. Everyone get you.
it's just the generation of, it's like we are recycling.
Trauma. So I've lost you again. I can't hear you.
Can you hear me?
Yes, I can hear
Can
you
you hear
now.
me though?
I can hear
Oh,
you now.
okay. The network is going off, but we are having a very good conversation. And whether the network likes it or not, we are going to have this conversation.
Right.
So I was just saying that it is almost like a pattern. We keep on
Mm.
going round and round. But whatever you know what my fear is. Whatever you don't put a stop to, you take it to your children.
Right. Yeah, there's that as
And
well.
so that is why it was very important for me to do this. It is not perfect, right? I mean, look at all the glitches, but I must talk. It is important we start talking
It is.
because
It is.
I do not want to see things like this in my children. It's not going to happen,
Mhm.
right? So this is not. It's about time where we start saying that, oh, I'm not interested in this matter. It's not. This matter is very, it's very controversial. There are some things that I would pick. There are some things I would not pick. And so when I was looking for people who would join me in this conversation, and I spoke to somebody, and she was like, "I don't want to talk about issues like this." I understand where she's coming from, but I also was telling her that you have to start talking about things like this. I know that it is very sad. I mean, there's another girl now that we are seeing online that the cousin killed, right? Because the policeman just felt like it was okay to release him, and he went to just kill the poor girl, right? After assaulting her for years, after raping her for years. But all these things are very annoying. When you see it, you get so worked up and you are vexed, right? But we'll keep on seeing this thing every day, every day, every day. Change comes when you talk about it and keep on talking about it and keep on talking about it, right? But if I say, oh, I see this thing, I don't want to talk about this thing, I'm so upset about this thing, then who will?
Yeah, right. Yeah, I think we're not angry enough until we start speaking and doing something.
Exactly, exactly,
It's not
exactly. And
just angry in your heart. You're not doing anything.
you, we have to. So I want to move to the next question, and I'm picking from what you said. You said you've come to. Can you hear me clearly?
Yes, I can.
Okay, so you said you've come to a place now where you look at a woman and she's complaining about something, and the signs, what she's complaining about is not adding up. Then you start asking for, you begin to ask questions relating to her marriage. So, what injuries or what signs do health workers look out for when a survivor is walks into a hospital or a clinic?
Right. Um. So, in my experience, it's mostly been um first from their demeanor. A woman who is not looking straight into my when you ask about in short, in the conversation, there's always a reduction in self-esteem with the survivors, with women who who experience gender-based violence. You're talking to them, they are not looking into your eyes, their heads bowed. But typically, what you complain about is, in my experience, two things. It has been body pains, and did you fall? Any fever? There's something like that. Body pains, and then there's palpitation. So palpitation is your heart is beating fast for no reason. Yeah, so I've seen typically body pains. Typically body pains. Pains that did you fall? And then some of them would even give funny reasons like, oh, something just happened. I just stressed. I'm just stressed, or I did something stressful. But these days I just I don't take that anymore. I fell, any I stressed myself, any is just malaria, and that's why
Yeah.
everybody. I just really want to ask for that. And then sometimes they come with their partners, and you can tell, they are you can almost read fear, you know. You can almost read fear. So usually I don't see women with their partners anymore. I don't see women
So
with their
I one
I
of
don't
my
stay
one
out. I don't want to assume you're in a loving relationship. Just stay outside and
at
finish.
all. We are not assuming. We are
Yeah,
not assuming because
yeah.
guess
Because
what?
some men, because it's also not common, you would assume that if a man comes with a woman to your hospital, then it means that they're in love and all of that. I don't make that assumption. And ideally, confidentiality, I should be seeing my patients alone. So, sometimes the men will say they want to stay, and staying means that the man cannot say what she needs to say.
She
So,
cannot say what's on her mind. Yes, exactly.
no, 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 no. Please,
And guess what? Even the most loving husbands are the ones that are even doing the most times. They are the ones that are really, really, you know, doing really terrible things to them, and they just hide in disguise of, oh, I'm a loving
yeah, yeah,
husband and I'm so
yeah.
romantic. Please
Mm-hmm.
don't be deceived.
And then sometimes their presence is not out of love; it's out of control. So the women,
Mm,
they can't go anywhere themselves. They are policing their phones, where they go to. It's just really crazy. And then sometimes when there's also economical abuse, it means that even if the woman comes to us, she can't pay abuse herself. So the man has to follow her. And then
this
I'm
is
sure
so.
somebody would say, why are we saying women for gender-based violence? But the truth is, it's just really mostly women that suffer these things.
Exactly.
I know that some men get beaten by women, but yeah, it's
Yeah, according to the data, I don't think that
women are the
opinion is wrong, but because according to the data, it shows that women are mostly the ones who get
yeah.
abused by their
Hmm?
intimate partners, right? So
Yes.
yeah, that's it.
Mhm. Yeah, so
So
so that's I pick signs of low self-esteem. The conversation is not smooth. You can tell that there's a lack of confidence, and then there's just unexplained body pain, anxiety. Sometimes there's psychosomatic symptoms. That means that you can't tie the physical symptoms to anything physical. Sometimes when something is wrong with the mind, it can show up as physical symptoms, and those physical symptoms are not
yeah.
actually due to this. They are due to, so anxiety, for instance, can show up as, say, chest pain, say, palpitations. It doesn't mean that anything is wrong with the heart or with any part of the body. It just means that because the person is anxious, they have those symptoms.
Mm,
So yeah, just really symptoms that
wow.
don't up. And then you can almost just read fear and a low self-esteem and a lack of confidence in them.
Okay, so let me ask you, do you think healthcare workers, right? Do you think would you say you guys respond quickly to someone who comes in that has experienced violence, any form of violence? How would you say in terms of the way you're responding to them, how quickly the medical attention is coming? How would you rate yourselves? Like, be honest.
Right. I would say that despite our best intentions, our response is limited. Okay, so let me give an. This was another colleague telling me what happened at the primary health care center. Actually, this one I'm in right now. Um, a woman who had experienced, I think, physical violence came to the hospital, told us what went wrong, told them what went wrong. They were going to manage, and I think after a while, the man came in drunk and started shouting and threatening to beat everybody that takes care of her. And then sometimes women don't even open up to that. Or sometimes they open up to it, but they're the ones also insisting that we don't interfere. We shouldn't just do beyond treating them. So I think that because of culture, and then you'd also find some healthcare workers who also play to the side of culture and society and say, I mean, again, this is years of socialization. So that's what healthcare workers. I mean, the fact that you're a healthcare worker doesn't mean that it doesn't mean you probably wouldn't believe that it's okay for a man to, it's not part of medical,
Mm,
it's not part of medical training to change that
it's
idea,
true.
right?
Yeah.
Though of course we're trained, the practices, because it affects the health of those we treat, we don't like it, or we don't want it, we disapprove of it. But I'm saying when it comes to response, some people are considering, or even if we intervene, for instance, if we report to the police, how would they even respond if anything happens to their husband? There's some women who people can be very interested. Sometimes you intervene and even the woman starts beefing you like,
Hey,
yes, I think
God.
our response is limited, because then again we can only treat what has happened.
Yeah.
Preventing, the most we do is advocacy, community education. But when it has happened, I think it becomes a criminal case, and there's sometimes limited in how much we can.
So, are there like, say for instance, and I'm saying this, I don't know, but you see something and you see that, oh, this is really, really, this is terrible. This person has done harm to this person. Can you guys go ahead to call the police or something without the, even if your patient is saying, oh, no, I don't want trouble, I don't want you to say anything, let's just keep it hush hush. Do you guys have that right to call?
To call, do you mean to like report to law enforcement or
Yeah,
something?
report to the police or, I mean,
So for rape, for instance, for sexual abuse, for instance, part of the guidelines for managing rape is to inform um, a law enforcement agency, right? But
mhm.
I've seen this again and again with teenage rape. I think the case that's coming to my mind now is, I think she was like 11. She
Yeah.
oxed, and then somebody she was going to sell to raped her. Before they came to the hospital, they had reported to the police. In fact, it was the police that brought the girl to us to confirm that a rape had actually happened, which is another problem, which is another funny, another very interesting aspect on its own. But they brought her to us basically to offer, post rape care and to confirm that rape had happened. That was why they brought her. They had already informed the police. But then, in fact, what we heard from even the policemen was not encouraging. Again, um, I don't know. I think culture influences even the way we deliver our professions as well. Because you see, they're
Yeah.
like, oh, like you said, what was she wearing? Why did she go to his house? Maybe she was enjoying it. And I'm like, for God's sake, this child is 11. Or I think she was 11 or 12 or so. She was a baby essentially. Yeah.
Oh my God.
So, but when it's an adult, there's patient autonomy. If a patient doesn't want us to inform, um,
Mm,
if a patient doesn't want us to report, say physical abuse, um, we can't exactly go against that.
wow.
For sex with a
Wow.
minor, which is rape, people typically even inform the police before they come to us. But then we also know how the law enforcement agency in Nigeria is. We also know all these things about confirming rape. It's quite a hard thing sometimes, you know,
Yeah.
even to confirm. Especially because sometimes people come back, people come washed up, people come, hours later, and you can confirm. Sometimes you can confirm sex. You cannot confirm that it was without consent, because it's not everybody that would experience trauma. You know.
Can you speak about that a bit? Because sometimes you hear things like that, like, oh, she went to the hospital, but they said it wasn't rape. But the person is saying, I was raped.
Right. So essentially, rape is sex without non-consensual sex, right? Sometimes we have to rely on signs of trauma, to
Mm,
prove or to suggest that they might have been raped. But like I said, if we're looking for say semen, say air or anything, any material from the perpetrator or the victim, we mostly can just say, oh, sex has happened. Was it with or without consent? I don't. It's not. It's hard to medically prove. It's easier when sometimes there's sign of trauma, or like, if it was consensual, it shouldn't be this traumatic. Some people have perennial tears. I mean, tear in their private part from from rape, but sometimes that does not happen. And sometimes it's even sexual assault. It's not rape. Sometimes it's those, for instance, with minors. Sometimes they're not even able to like penetrate, but they've assaulted them sexually. And oftentimes, I mean, many times those children even come back, come to the school washed up, and it's really hard to prove. It's really hard to prove. So even um pursuing, I'm not a lawyer, so but then even pursuing rape, um proving rape, saying that it has really happened, I think it's also quite a complex thing.
Okay, so it's very interesting just hearing it because sometimes I'm like, what are you people trying to argue about? This person is saying I was raped, and they're saying, oh, we can't prove it. So what you are simply saying is maybe let me ask this: what kind of trauma uh, has to happen for you guys to be able to say, okay, this.
um
Hello, hello, hello. Can you hear me? Hello, can you hear me?
Hello, sorry, just give me a moment. Just a second,
Oh,
please.
oh, okay. Oh, we're not just saying. I'm talking when there is an emergency. Okay, so let's give them a joy a few minutes. But I hope you guys are enjoying this conversation because I am. This is like the first time I'm hearing it like this. Because most times I see it online, I'm like, someone said they were raped. So why are you guys saying, oh, there's nothing to prove it? So let's just really take this and really, really learn.
Hello. Sorry, I'm back. So my phone was running, my battery was running low.
Okay. So can you hear me now?
Yes, I can hear you now.
Okay, so I was asking that what what signs of trauma do you guys want to typically see to say, oh, okay, this was rape, this was not.
Well, sometimes it's right, really rough. Usually when there's no consent, the person is also struggling. So you might find like tears on their body, like scratches, nail scratches on their body. And then in the private part as well, there might be tears, bleeding, tears, bleeding, in private part because the person was struggling. But it's not always there.
Okay.
I mean,
Uh,
if you come in immediately, sometimes you can see, seminal fluid around the victim's private part. But like I was saying, that just proves that sex has happened. Um, Sometimes it's those physical signs of injury or tears or trauma, outside the private part or even in the private part, that gives us an idea that it might have not been consensual.
hmm, okay. This is, I can't tell you how I am learning a lot. This is my brain, by the way. So, say for instance, somebody was raped or somebody was still abused. What should a survivor expect during a medical examination?
What should the survivor? What should the survivor?
And
Sorry, I didn't hear that.
I'm asking what should a survivor expect during a medical examination?
Oh, right. So would have to do a vaginal examination, just to see if there's yeah, and all of that. Would have to examine the vagina. So it's typically hard for them. Because I remember this little girl I was talking about. It was just really hard. I mean, I had to speak to her at first, like, oh, because again, it becomes traumatic for anybody to go there because something bad just happened. Yeah, so
Yeah.
typically I had to come out and like, oh, you're safe with us. We have to go the same place this professional has gone to, but this time we're doing it for your healing, and we just really want to check to see that there's no problem. So yeah, typically a vaginal examination.
Okay. How about for physical abuse?
How about for physical abuse? For physical abuse, the signs are usually obvious. Say somebody has had a fracture, somebody now has a wound or something. So usually for physical abuse, it is physical examination. We're just really checking your body, right? Sometimes we might have to do an abdominal examination, be sure that there's no internal injury to any organ. For physical abuse, it's just simple physical examination. And then for physical abuse, also the victim usually knows, where something is wrong. For
Yeah.
instance, yeah, someone has broken my arm. I know, oh, my arm is paining me, and then focus on that, and also check, generally.
Okay. So I do know that we have like a lot of male health workers. So in terms of both physical, both sexual, um, a survivor definitely can request a female health worker, right?
Yes. The good thing is there are now quite a number of us quite a number of females in healthcare. So
Exactly.
yeah.
Okay. So I wanted to be sure because I asked that question specifically because I had heard from somebody she she's an advocate. She's a lawyer. She does to advocate against rape and the rest. And she said that somebody had gone to the hospital and she didn't have like any signs, like physical signs of assault,
Oh.
and she just went to the hospital. And you know how some people can look very composed on the outside,
Mm.
but they're like freaking out on the inside. And she saw a male doctor, and she could not really like talk about it. She was like, "Oh, I want to request. Can I see a female doctor instead?" And the person was like, "I'm all you got. If you're not going to see me, you leave." And it was really, really terrible because apparently they said she was bleeding internally, something like that. I can't really remember the goes again. So that's the reason why I asked the question. We have the right to choose to say, "Oh, I don't want to see a male doctor. If there is a female doctor available, I want to see a female doctor."
Yes. The unfortunate thing though, because again, there's a shortage of doctors generally. So and still, I believe there's still more male doctors than there are female doctors. So a victim might not find, might not get the luxury of actually. I mean, I could walk into a hospital and say I want to see a female doctor, and they would say they don't have a female doctor. What I found to help is to ask for a female chaperone. At least there's a female staff in your hospital, even if there's no female doctor, there's a female nurse or a female whatever.
Yeah.
There's a female staff. So you
Mhm.
ask for a chaperone. For instance, if it's a case of sexual abuse, for instance, I don't, I'll not be surprised if a survivor is not very comfortable allowing a male who had, PTSD. They might not be comfortable allowing another male, examine or anything. But it's a patient's right to ask for a chaperone at least. So you can ask for a female chaperone. Oh, okay, I'm going to be seeing this male doctor, but I'd like a female chaperone to be present while I see him. So that would there's no that would definitely work because I mean you can't tell me that your whole hospital there's no female staff. Yeah.
Okay, would you say that would you say that in the healthcare, would you say that there's a special training for like healthcare workers, how they react and respond to people who have faced violence?
Yes, there is. I'll speak for myself and really community health workers that I work with. There's training. There's training. Even recently, in my department, we had a seminar on intimate partner violence and sexual coercion. So yeah, I mean reproductive coercion rather, because that's another form of abuse. The woman says she doesn't want more children. The partner insists that she wants to have more children. So yeah, it's something that we're trained on, because again, it's a public health issue. Considering how many women face gender-based violence, it's a public health issue, and it's something that we're trained, informed about, and equipped to manage.
Mm, okay. Um, okay, so apart from we've talked about a lot of physical, and I know that you're a doctor, but let's take it into psychological. Have you seen beyond the physical injuries? Have you seen any? What would you say are emotional? Okay, let me phrase it like this. What would you say are some emotional or psychological effects that show up immediately?
Mhm. Right. Like I said earlier, definitely low self-esteem. Definitely low self-esteem. There's fear, there's guilt, um, there's anxiety. It's almost as though they can't breathe without looking over their heads to be sure that the abuser is not around or wouldn't harm them again. So there's that fear. Sometimes there's guilt. What we're saying about some people just believing that it has to be something about them. It has to be me. It has to be something wrong with me. That's why it's behaving that way. So there's usually that guilt as well. And over time, there might be depression, lack of productivity. They can't do the things that they typically would. Because again, our productivity and the quality of our lives still depend on our social relationships. So if a relationship as important or as big as marriage, or an intimate partnership, as issues, then it definitely shows up in their productivity as well. Hello, are you with me? Hello, 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 hello,
Can you hear me?
okay.
Can you hear me?
Yes, I can.
My
Welcome back.
network is really acting up. It does not want this conversation to flow well, but
Yeah.
anyways. So I think we've said a lot. I think I just have two questions for you. I
Okay.
let you go back to what you were doing before. do we have like healthcare lines that we can call? Are there? It might not be even the national healthcare lines because we don't have things like that. Just like you would have maybe in the states, 119, 911, or something
Mm.
like that. Or are there like maybe organizations that you know of that people can reach out to?
Um, okay. So yeah, about the outlines, they might be, I'm not aware of them. And then even for organizations. So when I was working with a private hospital, we typically, if there's anything like that, we had a number to contact. It was an organization for women or who have been victims of abuse, and it was just a number to call, and someone to refer them to. So it works there in the private hospital. For the teaching hospital where I work now, there's a social there's a social support unit where we would refer, say, patients who are victims of abuse, patients who cannot pay their bills, just generally patients who need help. So it's that social unit that then links them up with organizations, that might be of help. So personally, I don't refer patients to organizations. We send them to social, usually like the social and welfare unit of the hospital. Um, there's a name for them I can't remember now, but yeah, they then link them up with those support groups. And then sometimes I take the liberty to step in myself. What's the problem? Is it that you don't have money? Is it that you don't have a job? Is there anybody you'd like us to speak to, say your pastor? Is there somebody that that is going to listen to? Are you planning on leaving? This is what you can do. None of that. Sometimes it's not really part of the scope of our job, but you get their numbers, you want to follow up. Oh, so how are you doing? There have been instances where I would speak to the partner. There was a time that the woman complained about violence. I spoke to the partner. Also, why do you do this? Your wife is not happy. He gave his reasons. I spoke to him, counseled, and all that. No, but typically we should refer to a counseling unit, a social support unit that can then link
Okay,
them up
I
with the
think
right.
that yes, please go ahead.
Yeah. So yeah, they then link them up with the organizations that usually typically NGOs, that can.
Okay. Please, if you remember any or think of any organizations, please,
Right.
I would personally be in your DM, and I will get those contact details, and I'll be sharing it. I'll share it on my Instagram at becoming Mary underscore, so that you guys can go really, if you're going through any form of violence, just reach out to
Mhm.
them because I
Yeah,
mean,
I believe
get the
there are a lot of
support and help that you
those.
need.
I'm going to just like do my yeah. I'll let you know.
Yeah. All right. Thank you so much. Okay. So the last question we have before uh, Dr. Joy goes is, if so for a watch this, right? What's one thing that you want her to know about her health, about healing, about her future in general?
Sorry for what? I lost you at the first part.
Okay, so I'm saying that if there is a survivor that would watch this
Right.
record later,
Mm-hmm.
what would you want to say to her? What would you like her to know about her health, about her healing, about her future? What's the
Right.
one thing you would say to her?
Right. I would say healing is available and
Hello?
possible. Yes, I can hear you. Yeah, so I would say, can you
Hello?
hear me? Can you hear me? I can hear you. Can you hear me? Can you hear me? Yes, I can hear you, but can you hear me?
Okay. Did you hear my last question?
Yes, I got your last question. So my message to any survivor is that healing is available and possible. Um, and that's something she should,
Mm,
look out for, something she should fight for. It's not your fault that it has happened. Uh, just just open yourself up to healing. essentially, and the future is bright. Your past doesn't have to determine your future. So get all the help that you need. It doesn't look like there's a lot of help. You might focus on the negatives or on the naysayers, but there's healing. There's healing, and God wants you healed.
Yeah. I think that that's such a powerful way to leave it. Thank you so much for your time. Guys, we apologize, but this was one of our most interesting conversation. I tell you, beyond the technical issues, it was really, really interesting. I learned so much. Thank you so much, Dr. Joy.
Because
I will be in your DM. I would overwhelm you with Thanksgiving. All right, guys. Thank you so much. I'll see you in the next one. Funny enough, the next conversation I'm about to have or I'll be having in this series is going to be so mind blowing. It's going to be so mind blowing. We'll talk about the law. All right. Thank you, guys. Thank you so much. Bye, guys.
thank you. Bye bye, guys. Right.